good afternoon, everybody. It's me, Kevin Stevenson. Thanks for joining me on I Don't Care with Dr. Kevin Stevenson. I always appreciate you joining me for our little get-togethers. So I've been reminding you every episode, follow me on Spotify, YouTube, iTunes. Come on, follow me on all the social media channels. Today's guest is Dr. Mia Keeys, right? You're
almost.
almost,
Me 4 more months.
you're almost there.
4 more months.
Mia Keeys, who is the Director of Global Health and Innovation at Hologic. Mia, welcome and congratulations on pursuing your doctorate.
Thank you so very much, Dr. Stevenson. It's really great to be here.
Thanks. And it's Kevin, please. Hey, tell my audience a little bit about you. I've been reading your bio on LinkedIn. It's incredible. So talk a little bit about what you've done.
So I must say it's been a really blessed and tremendous journey that I've been living. I feel like I've lived so many lives so far. But as you've mentioned, I serve as the Director of Global Health and Innovation for Hologic, which, as your audience may or may not know, is women's innovation company. And we focus on women's health across the continuum. I've been with the company now for about 2.5 years, and I initially came in as its Director of Federal Affairs, so interfacing with members of Congress and their staff, members of the administration, and so forth, and which suits my background very well. I came directly from Congress right before coming into Hologic. I served as the Chief of Staff to a member from Chicagoland, and for some years before I was her Chief of Staff, before I was her Chief of Staff, I was her Health Policy Advisor and also the Health Policy Director, Senior Director of the Congressional Black Caucus Health Brain Trust. And this is all under Congresswoman Robin Kelly. And then sometime in between there, I was with the American Medical Association. I helped to stand up their Center for Health Equity. But by training, I'm obviously very much a nerd, and I love all things related to public health, to health policy, to health equity, and artificial intelligence. And I've been a global health researcher in various countries, primarily in South Africa and for several years in Indonesia. What else? I'm a mama to a nearly 3-year-old. I love yoga. I love to hike. I love to read. I love art. And I love meeting good people.
That's awesome. That's very cool. Hey, tell me a little bit about your time in Indonesia. I was reading about that and it looked pretty fascinating.
Oh, truly fascinating. Have you been to Indonesia before? Okay, so first and foremost, you must go. Please put that on your must-do list.
Okay.
Sorry,
we're going to Italy next year. Italy's got Indonesia may have to be 26 or 27, but
that's fine. So long as it's on your list. But I was in Indonesia for about 3.5 years. Okay. Initially, I came in as a Fulbright fellow to a very rural area called Kupang. It's the landmass just above Australia, and it shares the land with East Timor. Okay. I think when I'm telling people, trying to describe where it is, I say it's basically right next door to it's East Timor, it's East Nusa Tenggara on one side, and then West Nusa Tenggara on the other side, and Bali is in West Nusa Tenggara. So that's the landmass where I was for my first year. And I taught English and I did public health works related to what the needs were in that area of the country. And then I moved to Jakarta for the last 2.5 years. And I worked with young people and their families on all kinds of things that were really basically hard to talk about, but had to do with health and emotional well-being, social, cultural well-being. And I taught English classes and creative writing classes. I'm a creative nonfiction writer as well. So it was a lot of fun.
My gosh, you are just a Renaissance woman. Wow. That's awesome.
I appreciate it.
That's awesome. So
there's so much to this life, Kevin. So we have to go for it.
Exactly. Hey, so tell my audience a little bit about Hologic and about what you do, what Hologic does as a company, and then, your integration of your global health and innovation title, in and around access and advocacy and all of that.
For sure. So Hologic is basically, it's a really very intentional, although albeit smaller company, a medical innovation company, to people's, I think, in terms of their name recognition, but pretty much every woman walking this earth at some point has to have a conversation about their breast health, about their cervical health, and that's where Hologic comes in, right? So we are innovators in terms of 3D mammography, which is the standard of care for breast health and, across the world, really. And also, we are a standard of care in relationship to cervical health, as I mentioned. So everything from Pap tests to HPV tests, co-testing, essentially, that's what Hologic really stands for. And our products really help to bolster women's screening, advanced screening, so that we can catch cancers before they become cancers. That's really the focus of it. But we also do all kinds of screenings related to, not just related to reproductive health or to traditional women's health, but everything related to STI testing. We were big in the COVID testing space when the public health emergency was going on. And really, when we're taking care of the woman and the woman's health, we're taking care of families, right? We're taking care of communities. So that's where Hologic is.
Okay.
And in terms of my work, so I primarily work to elevate our thought leadership through two very specific programs, but not just those programs, but specifically our Project Health Equity, which is primarily a support system for partner grantees who are doing work that Hologic believes in on the grounds, working with, especially with medically underserved communities, with historically marginalized and minoritized communities on all issues related to women's health and beyond, right? And then also we have a global women's health index that Hologic does in partnership with Gallup. And we ask questions representative of 97% of the adult population across the world, and basically just give a swath of information using a bunch of data to say what in the world is happening with women's health.
Yeah.
And that's what the Women's Health Index represents.
Okay. So I love indices and stuff like that. I'm a nerd too.
Yeah. Cheers.
Talk to me a little bit about, what country is number one in women's health?
What do you mean in terms of?
Well, as far as
your
index goes, I mean, what country would be positioned at the top, or countries?
So there are several countries that I'll tell you what's not necessarily at the top, right? So the U.S. is not at the top for women's health, right?
Okay.
We have a lot of the Nordic countries are usually pretty standard at the top in terms of access, in terms of screening rates. But we have, and then right in the middle, we have a lot of countries that Hologic is concerned about, so we're majorly concerned about countries, various countries across the UK, but countries across Latin America, certain swaths of the African continent, where, we're really concerned about what's going on in various areas of Asia, especially in countries where the population is just burgeoning, especially countries that are under the age, where most of the population is under the age of 30, or a large number of population of women are aging. As women age, our needs become even more verbose, and we've got to stay on top of that. But what happens across pretty much every nation, irrespective of one's language spoken, cultural identity, religiosity, women take care of everybody else but themselves, right? And so consistently, our question that we ask through the index is, well, what does it mean for a woman to be healthy? What does she care about? We talk about, some of the questions that we'll pose are, well, do you feel like certain health screenings are important? And for the most part, women are like, yes, absolutely. Almost a little over 40% of people will say, we definitely agree, or 90% of the women surveyed through our poll have said we fervently believe that different screenings, whether it be cervical cancer screening, breast screening, colorectal cancer screenings, they matter, but less than half of them are consistently going for the annual screening.
Why is that?
And there are reasons why.
Thank you. Of course, that's my next question. Why?
Okay, so why is, there are various reasons, but for the most part, women feel that it's either not relevant or necessary to them at that moment. And I feel like that question alludes to at that moment, meaning it's less important compared to other things. That's how that's how I would interpret that question, because you have, again, nearly 90% of women screened are saying, yes, this is important. Breast screenings are important. Mammograms are important. Cervical screenings are important. However, I have, these other things I have to do. So it wasn't important nor necessary for them. They don't have time. There's anxiety even that women hold about medical tests. There are structural issues, transportation, childcare concerns, even about pain
Yeah.
or discomfort. Um, I had a mammogram not long ago, and it's not necessarily the most comfortable situation, right? But for me, it's necessary because breast cancer has come up in my own family, and other women feel this same way as
Sure.
well, right? And then there's an affordability and access piece as well that has to be considered.
Yeah.
These are, so they're personal issues that matter in terms of how a woman behaves and seeks out her services in terms of health. But then there are also structural barriers as well.
Okay. So let's put on your advocacy hat.
Yeah.
What messages are you taking to the Hill about, how can we improve women's health in the United States?
For sure. So some of the main messages are, for one, we have to at the very least maintain access through our national healthcare platforms, right? So the Patient Protection Affordable Care Act, drafted and passed in 2010, and most of the structures went into place in 2014. It means that women have access to preventive screenings, including mammograms, right? And so just maintaining that level of preventive care, protecting that as the first line of defense, right? So that's one message that we thank our champions in healthcare, women's healthcare. Thank you for being supportive of maintaining this level of care for women's health. But then also we advocate with respect to the age and the age for different screenings. When it comes to breast health, when it comes to cervical health, we depend on the United States Preventive Services Task Force to say, hey, well, women within a specific age group have to consistently have access, right? And it's confusing for a lot of people. But the other thing is, we're seeing consistently, especially on the heels of COVID, Kevin, it's so scary. Women not only not presenting for services consistently, but once they do present for services, we're seeing more advanced
Yeah.
cases of cervical cancer, of breast cancer, especially around Black and brown women, right? And so what does that mean when we're talking to members of Congress? It's, well, your constituents are certainly going to be, they're voting for you, but also they need you
Yeah.
to maintain, to lean on USPSTF, to be in touch with thought leaders in the space and influencers in that space, in terms of policy brokering and making sure that all of that is protected.
Yeah.
Those are the main
Okay.
messages for sure.
What about rural healthcare? Are you
Oh
spending a
yeah.
lot of
Oh
time
yeah.
in advocacy on that? Because
Yes.
it seems like the last few of my podcasts we've talked about two subjects: access to rural healthcare and AI, and we're going to talk about AI here in a second. But what can be done in the rural healthcare setting? Because you and I both know, hey, mammography units are not cheap. And,
No, they're
and
not.
so, you look out, for me, looking out in West Texas, the availability of mammography, it could be 150 miles from some women. So,
Yes. Yeah.
what can we do about that? I mean, are we talking mobile
Yes.
units? Are we talking, what?
So the first thing is recognizing the systems barriers, right? So it matters to have the conversation and to foremost make sure that the consciousness of providers, of producers, industry folk are aware. This is the struggle. This is the main challenge geographically
Yeah.
in rural areas, right? So that's first and foremost. And then the other thing is, okay, well, if that's the case, there's a more long-term view and long-term strategy to consider, but what can be done in the interim, right? So for us, that means identifying major partners, trustworthy partners, people and organizations that already have their ear to the ground, but also have the ear of potential beneficiaries of medical devices that will really help to uplift the health of the nation, right? So that means, for instance, we work with Black Women's Health Imperative. We work with Promise Fund. We work with a number of organizations that are across rural areas as well. And so we work through them. What is it that your patients need? The other thing that I'm seeing and we see through Hologic is the significance of patient navigators, right? So they are those people who are sometimes literally holding the hands of women and their families and saying, okay, well, let's check in, let's take a checklist. Are you eating? What are you eating in a day? Are you fully hydrated? Are your children in school? Do you have public transportation or access to, and also, are you seeing your provider on a specific cadence? And patient navigators make a whole difference. Oh, I was going to use a more colorful word, but they make such a difference when it comes to helping people to literally navigate their way through such a, especially in rural areas where, to your point, you may not come across a mammography machine or even a hospital
Yeah.
healthcare system for miles and miles and miles, right? So it really does matter that there are people on the ground who speak the language of persons who are living in areas, who have a lived experience that's culturally significant to those who are hard to reach, or who haven't yet developed a trust in industry or trust in the medical institution. It matters. So I say those two things for
Yeah.
sure.
Okay. Very good. Well, let's go off on my next favorite subject, AI, because,
Okay.
we talk about access and, I know in my facility, we're limited in some of our modalities just because of,
Sure.
we may only have one or two machines and certain things, but we continue to have more and more and more patients coming to us. So we're looking at, advances in AI technology to be able to, sometimes double the capacity, if not more. Talk a little bit about that in women's health. What are you seeing? Major trends in AI, and let's go down that rabbit hole.
So let me start off by saying I'm super excited about this whole conversation and the idea of AI. And I'm saying just the idea in and of itself is something that a lot of people are so curious about, but don't understand, especially in the medical sense, what it means, what it amounts to, what it translates to in terms of their healthcare experience, right? So I want to acknowledge that. And then also, so I mentioned, and you know this, I'll be finished with my doctorate in several months. My dissertation is on health policy, health equity, and artificial intelligence. Right. So it's a timely topic, but I selected it way before COVID. So it's fantastic that it's now come into fruition in the way that it has. And so to answer your question, there's several things that patients need to understand, or aspiring patients need to understand. But also, I just want to encourage providers and physicians who are curious, or especially who are strained in terms of medical devices. AI could potentially be helpful, but not necessarily right in the clinical sense, like between patient and provider. AI in terms of assistive technologies could be helpful in terms of workflow for providers, right? So you all are burnt out. You've been
Yeah.
taking care of the nation, especially, in such really very critical times in the wake of COVID-19. A lot of providers are burnt out. So there are potential opportunities to leverage smart applications, AI assistive technologies to help with coordinating of EHR systems, right? So not just using Epic and it just work within one hospital healthcare system, but actual translation in between various places, right? So when patients move from specialty care to main provider, all of that comes with them, right? So if it helped with workflow, which certainly helps with hopefully helps with burnout, because you all spend so much time just entrenched in paperwork, right? So that could potentially make a difference before you even see a patient, right? But then when dealing with patients, the patient to provider relationship, there are technologies that, for instance, are more like ambient intelligence. So they capture notes or capture the conversation between provider and patient. And so long as I believe that there's consent from the patient saying, from to the provider, hey, do you mind having a conversation, or do you mind if our conversation is recorded? That way I can focus primarily on you, look you straight on in the eye, and then go from there. And then that makes a difference in terms of how a provider is able to inculcate trust between them and their patient. And then that matters then in terms of hopefully not feeling very rushed in a scenario where you only have so much time anyhow. And then that potentially could streamline on the back end clinical care. But to your point about, having so many technologies available and then having way more many patients, I think is the point there is innovations are moving faster than they're being approved by the FDA, and even faster than they're being reimbursed by CMS, right? These just for Medicare and Medicaid services. And for a lot of providers who are dependent on reimbursement levels be commensurate with the time, with the service, AI could potentially help a lot. But if CMS is not yet caught up to, okay, well, there's this technology that providers are using, it's not replacing the provider, right? It's just enhancing he or she's their ability to really care for the patient. Then we might be, stalled a bit. So I'm looking forward in the future, and this is an advocacy point as well, to Congress really being on top of not just AI in general, because there is a learning curve in Congress for people to understand what AI is about, but really understanding what it means in the healthcare space.
Yeah, I would greatly agree. You know, when I first started hearing and talking about AI a couple of years ago, I had no concept of it, but it's been really interesting seeing the evolution and seeing how, slowly but surely we're starting to integrate that into our treatment protocols. And I look at and again, just some recent guests on the podcast, talking about continuous cardiac monitoring, talking about continuous vital signs, things like that that will help. I mean, we all talk about the nursing shortage, but how much time does a nurse spend going into a room taking vitals? Where if there was an AI assisted device to leave on the patient that would allow for not episodic, you know, issues, but a continuous issue of, following, because how often, I feel something, but whenever somebody tries to, run a vital, it's perfectly fine. And so, having that continuous monitoring, you know, I was thinking about, okay, how could this apply in the women's health space? And you
Yes.
know, women are so intricate. I mean, it's just not in my mind. I mean, somebody's going to come up with an idea, but right now, I'm not seeing an idea. How can I do an AI mammogram? How can I do an AI pap test? Pap, I just don't see that, on the horizon. Tell me I'm wrong. Tell me you've heard of something really interesting that could be done.
So I'll talk about what Hologic is doing in the cervical health space, right? So we have right now, and FDA recently approved this earlier this year, a digital cytology, right, where you'll have, because right now pathologists are responsible for taking that co-test specimen, right, after an HPV test and a PEP, and looking at all the cells, like all those little tiny, potentially squeamish cells, hundreds of thousands of cells, and saying, okay, well, this one is potentially cancerous, that one's not, and just going through hundreds of thousands of cells a day,
Yeah.
and that's obviously tiresome to the eye. So now Hologic has a digital cytology where the cytologist can take the slide, pop it into the slide cast, and then the assistive technology will say, "Hey, there's a pattern here." It doesn't discern what the pattern is. It just points out specific cells and brings it to the attention of the pathologist, and then from there they can a lot more quickly and efficiently determine whether or not a patient is potentially carrying a cancerous cell or not, and then go from there. So we're well on our way. But to your point, like there's so much that has to be done before. Let me back up. You said slowly and surely, and I firmly believe you. It is inevitable that AI will be a part of every single facet of our life, including healthcare, right? But my concerns with that, along with my excitement, is that technologies have to be built with a patient experience in mind, right? So but not only with the patient experience in terms of them experiencing the technologies, but the technologies have to be built and designed with their lived experience in mind before coming to the design table, with their experiences in mind in terms of distribution and deployment. And so, we can innovate until our eyes are blue, and so many people are excited to do that. But to your point about specifically looking at what women need and what families need, we've got to have, bold imagination, but we have to be mindful to move at a pace that patients can trust, in a way that is reflective of their lived experiences.
That's a great word. Okay, Mia, we've only got a couple more minutes. Any final
Oh,
words?
fast.
Yeah, I know, right? Any final words? How can the public get involved? What can the public do specifically to help advance women's health?
Yes. So the first thing I would say is look up your member of Congress, because I'm not going to assume that just because someone lives somewhere, they understand who their member of
Sure.
Congress is or members of Congress, right? So first and foremost, know who your representative is in the House and who your senator is. And be in touch with them. Ask them questions. Ask their staff questions. In what ways are you advancing women's health? What do you think about women's health? What to you is women's health? And ask those basic questions and just be in touch consistently. And then as people are coming to understand where their member or their senator stands, they can ask deeper questions from there.
Okay. Very good. Well, that's a nice advocacy lesson for any topic. That's great.
For any topic. Any
And
topic.
coming from somebody that has the experience, I give you a lot more credence than some. So
I'm telling you. And let me say, I'm saying your member of Congress, but it's really the staff.
yeah,
It's really the
yeah,
staff. Know who their names are and be in touch with them.
absolutely.
Yeah.
Hey, Mia, I've really enjoyed this. Thank you
Me
so
too, Kevin.
much. This is
I appreciate you.
this is
Thank you so
this
much
is
as
great.
well.
Well, folks, Mia Keeys, Director of Global Health and Innovation for Hologic. Again, wonderful to have you on. Would love to have you on again.
I'd love to come on again, Kevin.
Talk about women's health and beyond. Particularly
Yes.
after you finish your doctorate.
Yes.
I know you didn't want to give that sneak peek just yet, but I'd love to hear a little bit more about the intersection of equity, policy, and AI. So
Let's come back to this next summer.
let's
We'll
do
have
it.
a fulsome
That sounds
conversation.
great. All right, folks. Mia Keys joining me today on I Don't Care with me, Kevin Stevenson. Thanks again for joining me. I never take it for granted that you always have other podcasts or other entertainment that you can participate in. But with that, we will see you next week. Thanks.